think we will start. I want to welcome everyone tonight. Thank you so much for joining us. I'm here, Lisa Feiner, with Steve Ledvina. We will introduce ourselves in a moment. And tonight we're talking about two things that you really might not associate with memory loss, which are heavy metals and hormones. So we're going to get right into it. Uh, So Steve and I are both certified health and wellness coaches, and we are board members of Sharp Again Naturally. I am one of the original founders of the organization. I've been a health coach for 19 years, and I have a father who was diagnosed with Lewy body dementia about 6 years ago. Steve?
And I'm Steve Ledvina. I'm a health and wellness coach. I specialize in brain health. I'm also a Recode qualified coach for Sharp Again. I'm one of the board members and a health coach for the Sharper Minds small group program, which we'll tell you a little bit about at the end. And I come to this work kind of similar to, I would imagine, a lot of you and Lisa. Just family experience, extensive family experience with dementia. I had three grandparents with dementia, and my family was heavily impacted by it for a number of years. Um, Before we kind of get started, one tiny piece of housekeeping, which is just that Lisa and I are both health coaches, and so we are not medical doctors. So while we're have a good knowledge base in these topics, we aren't doctors and we aren't capable of getting medical advice. So this isn't a substitute for working with your own doctor, which you'll hear many times in this presentation. We will recommend working with your doctor, particularly on these topics. So with that, back to you, Lisa.
Thanks, Steve. So some things that we want you to take away from tonight, and this is really true for all of the topics, that we talk about, is that the causes are mainly lifestyle and environmentally driven. Mean we have a lot of control over many of the things that will cause our memories to worsen over time through our lives. Um, Heavy metals and hormones, which you'll hear about tonight, definitely impact brain function. And again, while you may feel like you can't control heavy metals and hormones, you'd be surprised. And we're going to share with you ways that you can. There's no question that getting out in front of some of these issues will help to prevent memory loss later on and also avoid other health issues. Unfortunately, the whole body and the brain are so intricately connected that we can talk about one topic, but often it will impact many of the other things that are on our list. And taking action now will certainly improve your memory and help you to stay sharp throughout your entire lives. So, who are we as Sharp Again Naturally? For many of you are familiar with who we are, so I'll go through this quickly. But we are a nonprofit. We were founded in 2012, and our mission is to educate the public and the medical community about causes of memory loss and dementia, and to empower everyone to take charge of their cognitive health and really their overall well-being. Because again, the body and the brain go hand in hand. Um, we help people support lifestyle changes that can improve their cognition through a variety of means, especially our small group program. And Steve is one of the primary health coaches in that program. And we partner with like-minded professionals and organizations for many, many reasons. To get the word out, to monitor research, to collaborate on events and other kinds of things, to write articles. So there are many ways that we partner with other organizations and doctors and practitioners. So, during some of these webinars, we talk about statistics very briefly. And this one especially is one that Steve and I thought was helpful to have a perspective on, which is while incidents of things like heart disease and many other kinds of cardiovascular disease, that these things have decreased over the last 15 years. Alzheimer's has increased so substantially, and we're seeing the numbers go up as our population ages, and not only the American population, but the population in countries all over the world. So while there are some statistics that say, well, maybe there isn't as much, prevalence of or diagnoses of Alzheimer's every year, the actual numbers are increasing. And it's really for that reason that we are so passionate about this work that we do. Um, so what's the good news? I mean, the good news is that mild to moderate cognitive impairment has been successfully treated and is being, it's happening every day. So we're fortunate that we get to talk to people who can share their stories with us, and also doctors who are publishing their work. We're continuing to see these positive results using the same kind of lifestyle and other interventions we speak to you about. Genetics, and especially the ApoE4 gene, play a role in that they may increase your risk, but they're not going to determine whether you get Alzheimer's or dementia, that there's so many other things that you can do and steps you can take, which is again why we're here tonight. And also we encourage you to start now, that prevention is certainly the best option at this point, and things that you do today will keep your mind sharp for the future. So I wanted to just quickly, I know those of you who have been on other webinars have heard this list. Again, we'll go through it quickly, but we want you to understand the causes that have been identified so far. And, we're even monitoring other things that may get added to our list. So nutritional imbalances and deficiencies, which we've talked about previously, toxins in food, water, air, work, and home environments, the effect and interaction of prescription and other medications, heavy metal toxicity, which we'll be discussing tonight, and hormones. Low-level infections can come from so many different places. Sometimes we feel them and we have pain and inflammation in our body, and other times they go totally undetected. As people get older, they'll often have urinary tract infections, for example, that will only be identified if they're in the doctor's office for something else. Oral infections that can go on for years even, that again, it may take a special diagnostic for a dentist to be able to see that. And again, Lyme and mold and food sensitivities and some of these other things. These are the lifestyle causes. So getting enough exercise, keeping the brain stimulated, and especially this year, which has been so challenging, social interaction. Prolonged stress. So again, I think anxiety and stress this year have certainly been challenging for many people. Sleep and breathing issues compounded to that stress, and physical and emotional trauma. Literally, this any kind of physical or emotional abuse that can start in childhood and happen anytime during our lives can impact brain health later in life. So we're going to start with heavy metal toxicity. That's our first topic for tonight. So, let's talk about mercury first of all. But there are many metals that are in the atmosphere, in the Earth's crust. We need some of them actually to be healthy. We need a certain amount of copper in our bodies. You're all aware that iron is important for healthy blood. But there are these other metals that are referred to as heavy metals, things like, mercury and lead and aluminum and some other things that if we have too much of them in our body, it's not a good thing. And there are particular ones like mercury that are extremely neurotoxic. They affect our nervous systems. And depending upon your genetics and what your exposure is, um, you know, it can really impact your brain health. So, mercury is 50 times more neurotoxic even than lead, which we know is problematic. And not only does it accumulate in some of the, the sources, but it will then accumulate in our body over time. And so this, once, the body likes to store heavy metals in our fat. But after a while, it goes to the organs, and at some point we're really not able to manage it. And at that point it can produce symptoms identical to Alzheimer's disease. So heavy metal toxicity and Alzheimer's disease can actually present like the same thing, but they've got totally different origins. And heavy metal toxicity, especially mercury, has been linked to Alzheimer's in key peer-related studies. So a lot of these periodic table notations that you see inside this fish here are things like zinc and mercury, lead, copper, nickel, arsenic. And the bigger fish eat the smaller fish. And so these big fish are in the ocean a lot longer. I'd like to tell you a story about Denise, because she's really a great example of how mercury can cause damage and how it can then be treated. So Denise was a flight attendant, and for cosmetic reasons, she really wanted to have a nice smile that wasn't filled with silver, and went to her dentist and said, I really want these silver fillings out. I want white fillings instead. And so he drilled them out for her. Unfortunately, she did not realize that being exposed to not only the mercury vapor, but also little pieces of mercury that get reabsorbed in the body, she got very confused. She couldn't go to work. She got lost, and she was putting food under her bed. Like, she was terribly confused and at times delirious. And she was really not able to function very well, but she had a friend that sent her to a holistic MD she knew, and who tested her for mercury toxicity. And she was able to detoxify over many years, and it was not a straight line. But she was able to get enough mercury out of her system and get well enough through chelation and changing her diet that she didn't go back to being a flight attendant, but she did recover, and she lives independently and is so grateful really to have her life back. So we wanted to show you so this over here on the right, this piece, I don't know if you can see it with my cursor, but it's a piece of mercury here on the right, and it was put in the environment of this neuron, which was started, actually went all the way to the upper right-hand side of this picture, and now has shrunk back to half its size just in the presence of mercury in this area. So you can see the impact that mercury has on our neurons. So if we look at, the sources of mercury, in 93, I can tell you that it was the World Health Organization said is the primary source of mercury. I think today it's still very high. It may not be the absolute number one, but we should understand that dental fillings are all 50% mercury, and that these fillings have been, they're considered hazardous waste when they're taken out of the body, but not when they're put in, which is kind of ironic. So they've been grandfathered in. The FDA really never did adequate testing, 50 years ago. And so they're not going to take it up with the ADA now, although many dentists are aware that silver fillings and mercury in particular are problematic. Unfortunately, some dentists are still putting these in people's mouths. But when you have them taken out, they need to be um, taken out by someone who's been specifically trained. And if I showed you a picture of a dental operatory where they're removing mercury fillings, you would think you were in, a hazmat unit, because they are dressed head to toe in protective equipment. There's an alternative uh, air source, so over the patient's nose, so they're not breathing in mercury um, vapor, and also a rubber dam in the mouth, so that all of those little pieces that get drilled out, if any of them aren't caught, that they are caught in this dam. So this really reduces the impact of the removal process. And before having anything done, we really encourage people to have a heavy metals test, because heavy metals are not problematic for everybody. They are for some people, for many people, I should say, um, a good part of the population, but not for everyone. And so even if you have silver fillings in your mouth, it may not be a health issue. Um, there are other people who say if you have heavy metals in over the long term, they are going to degrade. And so they may at some point become problematic. But that's something for you to discuss with an integrative doctor and your dentist. The other thing we wanted to show you is, I know this is a little hard to see, but if you look above this filling, there is this shadow of mercury vapor. When mercury is heated, for instance, when we have very hot drinks, um, there will be some mercury vapor that is released. And so it's subtle and potentially not a lot each time, but what becomes so insidious about some of these things is that it's this long-term exposure. So as we brush our teeth and as we eat and chew, the mercury starts to degrade, the vapor gets released, and over, decades, a lifetime, this really can become problematic for our bodies and our brains. So let's talk about where else we're exposed to heavy metals. So I talked a little bit about steak fish. These large fish that live in the ocean a long time and eat a lot of other fish. So tuna, halibut, Chilean sea bass, shark, and swordfish are some of the most common popular large fish that people eat a lot of. Um, Another source is air and water pollution. Um, you should see the research that's been done with people living very close to power plants and the incidence of dementia. It's very high. So, we know that this is an issue. And these studies, they come out fairly regularly. Mining operations, city smog. I'm even going to suggest exhaust, the particulate matter that comes from idling engines of trucks and cars, not as much, but this particulate matter gets into our bodies through inhalation. And again, it's just part of the body burden that builds up over time. We see aluminum. So, aluminum is one of those metals that is controversial in that you find studies that definitely link it with memory issues and others that seem to not. In our experience as health coaches, we encourage people to make sure their pots and pans are not aluminum. And while I'm mentioning it, not Teflon or non-stick, because those have chemicals in them that also are problematic. And also to look at aluminum chlorohydrate, aluminum byproducts, aluminum salts that are in personal care products. If you can make another choice of, of personal care products that don't contain aluminum, all the better. We know lead is problematic for children, But over time, of course, it's problematic for adults as well. So it's found in paints, although there are many, you can get paints today that have no lead in them. But old buildings and old paint is problematic. Lead in plumbing. Um, Unfortunately, a lot of the plumbing gets degraded over time too. And so we get the byproduct of that. I mentioned cosmetics, especially in things like lipstick and some of the other cosmetics that young women and middle-aged women are really using all the time, and ceramics. And then vaccines containing thimerosal, and or aluminum, because aluminum is also being used as a preservative, especially in the multi-vial, multi-dose vials, I should say. So just something to keep in mind. If you can have a vaccine that's a single dose vial, all the better. So what can we each do? What we try to do in each of our webinars and presentations is to give you tools, give you ideas about how you can make maybe one or two small changes to your daily lives that will improve your overall health and your brain health. So here are some ideas. Just try to be aware of how you're being exposed to some of these heavy metals day in and day out through your food and perhaps your dental work and your environmental exposure. Some of the things that we've talked about today, through your cosmetics, and look for ways to reduce your exposures. Here are just some ideas. Change out your cookware or read labels so that you know what's in your products. If you're eating steak, fish, twice a month, eat it once a month and slowly try to kind of trim down from there. If you think that heavy metals might be an issue for you, if you have like a mouthful of silver and gold, and the more metal you have, unfortunately, and it can interact with each other, get a heavy metals test, and then you'll know, and it will give you an idea of how you are to. I think they look at least a dozen different metals. And if your levels are high, you need to seek out people who have been specially trained to either chelate or treat heavy metals, getting them out of the body. And there are different ways to do that. So it's not just chelation. There are ways that toxins can be pulled out through the skin, through infrared saunas. There are oral chelation therapies. So there are different ways to do this, and to find doctors and dentists who know what they're doing in this arena. All right, so we are going to transfer this over to you, Steve. Talk about hormones.
Okay, everyone take a deep breath. We're switching topics here a little bit. And we're moving from kind of the heavy metals, so toxicity, to now something that's integral to just everyday, biological processes in the body, and that's the hormones and hormone imbalances specifically. And so which hormones are we talking about? Next slide.
Here we go.
So there's really three different hormone categories that we're talking about when we're talking hormones and their impact on the brain. It's thyroid, and so even within thyroid, there's sort of two different versions of thyroid hormones. It's T3 and T4, and you'll hear that come up again. Gender hormones that we're talking about here include estrogen, progesterone, and testosterone. And then stress hormones, you might also hear them talked about as kind of adrenal hormones or the adrenal axis, and that includes cortisol, pregnenolone, and DHEA. And with these three categories, it's important to understand we're trying to optimize the levels of these in the body. They all have really important processes throughout the body. They relate to each other, and they all have a strong impact on maintaining neurons, synaptic health, and different things. So it's not just that we want to be kind of in that normal range. We're really trying to optimize the levels of these in our bodies.
Steve, I had forgotten to say earlier that if people have questions, they can put them in the chat box, and then we will get to them at the end.
Yeah,
Okay.
please feel free to enter those as we go. So this is Dr. Lou. So Dr. Lou is a really interesting story of kind of how hormones can really affect your brain health, really at any age. And in her case, it's when she was in her 40s. And so her story kind of begins with her working with patients. She would normally kind of be have a strong enough memory to be taking notes at the end of the day, but she noticed that her memory was kind of degrading to the point where, to trust herself, she had to immediately take notes after each patient. And so one of her patients actually recommended that she get her hormone levels tested. They knew of a doctor that they were seeing, and they kind of pointed her in that direction. And she tested with hormone levels kind of greatly out of the normal range. And in this sense, we're talking about those of an 80-year-old in her 40s, which would be drastically depleted. And what ended up really helping was this bioidentical hormones helped restore her memory. So that's an important piece that, as we're going through, if you encounter yourself in one of these scenarios, there are different hormone therapies that you can get, different ways to handle these, and kind of having that phrase bioidentical in mind, because there are different animal hormones, there are different synthetic hormones, and you really want to give your body the type of hormone that already exists, that it's already using something that kind of fits right into the way your body already works, rather than something that's a little bit different. And now, yeah, so to complete the whole story of Dr. Lou, she actually was inspired by this to start working in this field to become an integrative doctor. And then she specializes now in environmental toxins. And so what do we mean when we talk about inadequate hormone levels, or more accurately, how would you know? So just to reiterate, the inadequate levels of all of those hormones I mentioned before, they can impair memory, focus, and cognition. How do you know? It's as simple as working with your doctor. This is one of those things I mentioned at the beginning. There are some things you can do to kind of look up symptoms, do kind of basic testing at home and just observation, but really the thing you need to do to take the next steps on this particular topic is get tested. There are lab tests. And then again, correct any deficiencies. So it's important to note too that some people can correct deficiencies with just the other lifestyle factor type things. Occasionally deficiencies can be nutrition related, or could be corrected by doing things like exercises. But if that's not the case, then that's something you would want to work with your physician with. Bioidentical hormones and supplements can be used to correct kind of levels of all of these, as well as, we'll talk about with stress hormones, lifestyle factors might help. So gender hormones. Why do we care? What is the connection with brain health? I'm just going to give you kind of three things to hammer home why we care about optimizing the levels of these. So in women who have their ovaries removed before age 40, it actually doubles their risk of Alzheimer's. And that's a big factor you'll see with the Alzheimer's prevention kind of field physicians looking for. And the role of estrogen and progesterone in cognitive function is still being studied. It's being debated. And really the thing that's being debated is there evidence enough to be doing hormone replacement? How long would you want to do hormone replacement? What types of hormone replacement? And so it comes down to, there's evidence to suggest at this time that, and opinions will differ on doctors, that a well-designed bioidentical hormone replacement program can improve cognition. And then for the men out there, testosterone supports neuron development. And we see that the men with the lowest levels of testosterone are actually at the highest risk for Alzheimer's. And so just gender hormone balance and these powerful hormones have a really strong effect on our brain health. Next. So now we have the story of Helen. So Helen was a marketing professional, and she found that she couldn't work, and she was having kind of issues with depression, trouble walking, losing hair, and just was in a pretty bad place. And she was kind of advised through the internet, in this case, a Google search of symptoms, and somebody who kind of suggested her to get testing online, to get tested for T3 thyroid hormone. The kind of important thing, which we're going to talk next, is that she had already been tested for her thyroid levels, and her thyroid level came back. And you might wonder how that could be. There are different tests for thyroid levels. In this case, T3 is the one that would have turned up that she was having a thyroid issue, and so the doctor missed it. I'll talk in a little bit that I would guess her T4 or TSH levels came back normal. Then she kind of came up into this sort of second issue, which is that Synthroid, that T4 I just referenced, was the kind of non-bioidentical therapy that she got, and that didn't end up helping. But then once she kind of switched over to this natural desiccated thyroid, that low T3 ended up being corrected, and it brought her mind back and relieved symptoms. And today, happily, she's active and healthy. So, kind of taking a half step back from Helen's story, what is thyroid? And kind of what are the symptoms, what are the effects? So thyroid is really the hormone that controls the speed of your metabolism. And, it's as simple as kind of the energy production in the body. So one of the ways we can tell if you have a low thyroid function is actually just measuring your body temperature in the morning. And if your body temperature is low, meaning your metabolism would be low, then it might signal that you have thyroid issues. Thyroid has a lot of different symptoms. It can affect mental acuity. Your body might be colder. You might feel colder. Weight gain, depression. One of the really common ones is constipation, depression, dementia. But there's a lot of different things that can be caused by thyroid issues. And then finally, as I just mentioned, it as a symptom, but it's also just common across the board. Suboptimal thyroid function is common in people with dementia or cognitive impairment. And it can be a cause of that or a symptom of kind of a more broader complex of suboptimal things. So problems with thyroid testing, I'll kind of roll through this because I alluded to it already. You can test normal depending on the way in which your thyroid is suboptimal. So there's T4 thyroid hormone and T3 thyroid hormone. T3 is really the version of it that your body uses, but often the testing that you would get just standard out of the box from your doctor would be T4 and TSH. TSH is thyroid stimulating hormone, so it's actually the hormone that gets the thyroid to produce these other hormones. We convert T4 to T3, so T4 to that more usable T3, and that ability often declines as we age. As that ability to do the conversion changes, one of the therapeutics that we mentioned just previously, Synthroid, can become less effective, and even kind of raising the dose of that isn't an effective thing if your ability to just transfer one to the other is diminished. So supplementing with or treating with T3 hormone would be better. So 2 standard tests, I've mentioned that a few times, so I'll just jump into what are the tests you want instead of just those 2, and I'll read them off. So you'd want to check for thyroid peroxidase and thyroglobulin antibodies, and then free and total T4 and free and total T3, as well as reverse T3 and then the TSH, thyroid stimulating hormone. And so that's going to be kind of all of the bases covered, so that you'll definitely know from that testing suite if you're having a thyroid issue. So then finally, the final piece of the hormones that we alluded to at the beginning are these chronic stress or stress-related hormones, adrenal complex. So those are cortisol, pregnenolone, and DHA. And what exactly do they do for brain health? So just, we've probably all heard of cortisol. That's kind of the poster child for stress hormone. So high levels of cortisol just all on its own can damage neurons, particularly in the hippocampus, which many of you who've been to a few of these webinars may know that that's kind of the memory center of the brain. The second thing is, if you can imagine, the body has a stress response for a reason, right? It's kind of part of the immune response. It's one of the ways that our body protects itself against harm from different things that could damage it. Those things, in this case, being infection, toxins, lack of sleep. Well, if our body's stress response is always a way up here and that's kind of maxed out, when a threat comes in, we have nowhere to go. There's no extra room to kind of ramp up the stress response, ramp up the immune response, and defend against the issues that your body is encountering. So if you have chronic high levels of stress and therefore chronic high levels of stress hormones, you're going to be more susceptible to those different kind of threats that your body may normally be able to defend against. And the final connection, which is perhaps, at least I think, the most interesting connection, is this connection from the stress hormones to the gender hormones. So pregnenolone is actually the precursor, the same molecule, essentially the same, that turns into pregnenolone, is also the precursor to some of the gender hormones. So if you're really stressed and your body's taking that precursor and turning it into stress hormones, then there's just less of the precursor to turn into gender hormones. And then I've heard that referred to as the pregnenolone steal. And it's essentially that and there you may kind of think of some biological processes that would be result from, things that you know from your own life, that when you're really stressed, a lack of kind of the gender hormones might show itself. So high stress means lower gender hormones in many cases. And as Lisa alluded to earlier, really what we want is to always leave you with kind of what are the next steps. And in this case, I've said it a few times, I'll say it again. The best next step, if you're worried about any of these, if you feel you might be having issues with any of these hormones, if things are ringing a bell, go to your doctor, particularly somebody who's experienced in this. An integrative physician is kind of the perfect example of that. Get the lab testing for thyroid, gender hormones, and the adrenal complex. And if you do have hormone replacement, make sure you're working with your doctor to ensure that it's bioidentical hormones. I will say, because finding a new physician is often kind of difficult if you don't, working with an integrative physician, working with your doctor is perfectly okay, but you might find, for example, in Helen's case, that you have to do some advocating for yourself to make sure you're getting the right tests, to make sure you're getting the bioidentical hormones. If we could go back a slide.
Yeah, sorry.
So this is a super simple one. This is what I alluded to earlier. The thyroid hormone, low thyroid or hypothyroidism might be able to be detected by just measuring your body temperature right when you wake up. I believe the metric for that is if your body is consistently lower than 97.8. I wouldn't necessarily be super concerned if it was just like 97.7, which is generally what I am, and I'm not concerned. But if it's significantly lower than that, then you might have a thyroid issue. And then finally, just with the stress hormones, that's heavily related to a lifestyle factor of just having high stress. And sometimes those are things you control, sometimes they're not. But you might implement some of the ways that you can manage that. Maybe it's managing the stresses themselves, but if not, it can be things like meditation or yoga, or just kind of going for a walk or doing something that brings you joy. Really, I think you can kind of imagine what those things might be. So finally, just hammering home on we've given you a few things to do next. If any of these things are ringing a bell with you, we're just going to ask the question, what is one thing you can do now to improve your brain health? If you came out of this thinking, man, perfect, I have no heavy metal toxicity issues, I don't think, and my hormones are balanced, then great, you're here thinking about brain health. So why don't you choose something from the lifestyle factors that you could kind of improve? But I would guess most of us have something we can kind of look out for, observe in our lives that we might at least just make sure these things aren't a part of our health. So
put your answers in the chat
box if you've got one.
Yeah.
We'd love to hear. It helps us to hear. It'll probably help other people to hear. That's something we find in our small groups, is that a lot of times when one person voices something, whether it be an issue or a strategy to help make it better, it kind of resonates and helps everybody kind of popcorn back and forth and make improvements. So we've got the chance to do that together here.
Well, as I was helping to prepare the presentation and kind of reviewing everything, I said, I really need to go back and check all of my personal care products again. And because it's been several years, and just make sure that read all my labels again. So, you could be doing this work and still be learning something every day about steps you can take. So,
yeah.
Are any of them showing up in the chat box that you want to share, Sue?
So I'm seeing things like exercise, get more sleep, which was my personal favorite, meditate, and remove fillings, new pots and pans. So a nice cross section.
Great.
Perfect.
And we do have some questions.
So we'll take
it
it
at the end. And then we'll get to your questions.
Yeah.
So
like a pet, that's a good one.
Yeah, perfect. That'll reduce stress. So sharper mind, small groups. So, I think I see a number of familiar faces on these that I know aren't part of the small groups. And if you've kind of been coming to webinars, making progress in your health, this would be a great next step. So our small group programs are a combination of kind of coaching and education. They're one-on-one, a couple sessions of one-on-one coaching, and then group coaching and goal setting. And the whole program is structured around you kind of taking the next steps in your health and taking control of the parts of your health that we know, the lifestyle factors that we know can improve the brain health. And then working within a group for support and accountability, working in a coaching context for guidance and kind of help structuring goals, and just using the coaching context to ensure success. And then the education, and we've really worked hard to kind of structure the education aspect so that it's highly usable and the type of kind of knowledge giving that you can go and implement and make strides with. We're not necessarily educating just for the heck of it to kind of take you through a textbook class, even though we probably would love that, because the information to us is just fascinating and I think I can't learn enough about it. But the whole goal here is really to help you be healthier, and that's kind of why we started these small groups. So I will stick around at the end for a few minutes in case anybody has any questions specifically about that. So please feel free to kind of stick around for a minute or two and just ask questions. Otherwise, you can email sharperminds@sharpagain.org, and that comes directly to one of us. Or at the end, I think both Lisa and my emails will be displayed, and feel free to email either of us as well and to ask any questions. I would even be happy to hop on the phone with anybody if that would help too. So then here are the kind of the other ways we can, you can work with Sharp Again. We will have more webinars in the future. We just don't have them scheduled right now. You can visit sharpagain.org for lots of great information. Like I said, you can join or refer someone to our programs. If you know somebody that wasn't here tonight, just kind of send them an email and CC us, and we can take it from there and helping kind of answer any questions they might have. Here's a thing I'm excited about that we've done in the past, and we're really hoping to do a lot more of it this year and expand kind of the universe of people that know about different dementia prevention things, which is to ask you to host us in whatever communities you're already in. We would love to come and just do kind of an overview of dementia prevention topics, or if you have something specific to your community that you know would be useful. Maybe you have an office that's pretty high stress and you're interested in hearing about that in brain health. We'd be happy to come in, and whatever that example might be for your community. And finally, we would invite you to kind of join into our community by supporting Sharp Again. And there's kind of the donate link. Sue, if you could drop the link in at some point to the small group so that people can just click through to that in case they're interested, that would be wonderful. And finally, Q&A time. I think everyone should be able to see Lisa and I, and Sue will ask questions.
So these are the email addresses. If you want to send a message directly to Steve or to myself, you can also contact us through Sharp Again at info@sharpagain.org.
Yeah.
Okay, so I'm going to stop sharing, and we can take questions.